Hi, everyone. It's our 4th annual Making Dad Summit, and I am so excited to be here with Sara Naab, my partner in crime for our Making Dad Summits, and of course, our wonderful friend. And Sarah's going to take it over and do the big intro.
I'm so happy to have Dr. Brahmbhatt back with us. He just got back from a cross-country trip. He is a spokesperson for Men's Health, and they just had their annual Drive for Men's Health, which is this incredible event that crosses the country and really does amazing things to build awareness for men's health. And this year their theme was What's Under the Hood. Did a lot of crazy antics on their bus as they talked to a lot of guys about a lot of health issues crossing the country. And Dr. Brahmbhatt's a urologist in Florida, and he's a rising spokesperson, really putting a spotlight on men's health and men's reproductive health. And he's a great friend, and I'm glad to have him back because we always have fun bantering about these things.
Well, thank you so much for having me. I'm not ignoring you guys. I know if you look on social media, it looks like I don't work, but I actually am working here in the OR. So.
Are you in a closet? Where are you?
Yeah, it's a closet. I have to find some quiet space. You know, that's hard to find here in the hospital. So.
Well, we so appreciate your time and generosity with your knowledge, and you've been right there with us every year, and so we're so grateful. So today we're talking about something that Sara and I mentioned, and we knew you were the guy to talk about it. You know,
what's that? Masturbation?
You know, those questions
not because of personal experience, because of professional experience, right? So just want to make sure that the audience knows that.
Right, and all those questions that, you know, guys are afraid to ask. So we knew that you shoot from the hip and you're all great with this stuff. So I remember way back when I was going through my journey, you know, all the rules and regs around when you were going to have your insemination or when you were going to do your IVF, and, you know, should you abstain or should you not abstain? And, you know, so I think that is so important, not only for trying to create your family, but also how it relates to men's health. So.
Well, I mean, first and foremost, everyone needs to know that both males and females masturbate. So, you know, it's like such an awkward, like when you bring that up around people, they're like, oh, did he really just say that? Oh my God. But, you know, everyone masturbates, and we need to be comfortable with our own bodies. And I think this was one topic that men are more open to talk about than women are, which is rare because mostly men don't like to talk about these things. But when it comes to males, masturbation is often something that they discover on their own when they look down when they're younger and like, whoa, what is this? And then they start experimenting and boom, you know, they start finding one of the luxuries of life, I guess, for lack of a better phrase today. But an issue becomes with masturbation, I mean, it can become addictive. It can cause problems such as penile pain if you do it too much. Actually, just last week, 2 weeks ago, I had a patient come in with penile pain, and I asked him, like, hey, you know, about his masturbation. He's masturbating 8 times a day without lubrication. So, you know, maybe that's what's causing your penile pain. Maybe you don't need any kind of surgical intervention. But oftentimes, masturbation can also cause issues with fertility, not because you don't make enough ejaculate, but it can cause erectile dysfunction issues where you're so used to stimulation from, you know, either watching internet movies or doing it on your own that when you start having to do it with your own partner, it may become a problem. So it's fun and it's very pleasurable, but it's needs to be done, I guess, in moderation, as anything in life.
All things in moderation.
We have to have T-shirts with that made up. All things with moderation.
We actually had someone masturbate on our tour this year and did a live semen analysis using this new device called Trak, where you can measure your sperm counts at home. And
wait, who's making that? Who makes that?
Huh? I don't know. It's some cool people out in California.
What was the name of that company? Is it Trax?
Yeah, it's Trak. Yeah. No, but it was really cool because you know, we had like 10 guys on the bus, and like this one guy was macho enough to do it because he's like, I'm single, and it'd be cool to know, and what better way to do it than online on a bus. And the bus is like, we don't allow people to poo in there. We don't allow them to do anything. And so this was like huge for even our team to allow someone to go into our RV bathroom and do it. But he did it, and he had over 40 million per cc. So he was doing great. But yeah, you can masturbate anywhere, actually, I guess, even on an RV.
Well, that's good to know.
That was an incredibly, actually, it was a very powerful video watching that. And it broke so many taboos in my mind, just watching the whole group there, and his honesty and sincerity being there, and also like wanting to know his sperm count and being a little bit like, crap, I'm like finding out my sperm count on like live.
Yeah. Oh my goodness.
Like, what if it's bad? Like and there was a really good, honest discussion that I just, it was really touching for me to watch. It was also funny because, there's
really?
Because he was masturbating on Facebook. I mean, he wasn't masturbating, but like that was the conversation, right? And so we break the ice with, a lot of humor around this stuff. But I think I just really appreciated seeing on that.
That is, well, you're just the trendsetter. You know that. What goes on the bus doesn't stay in the bus, right? It goes on Facebook.
Like a lot of people think, we've had some comments in the past, oh, you guys are just having fun. But that's what keeps guys watching, and that's what gets people interested in us. And throughout all the fun, like, we're throwing messages of good health. And, this guy is single, and he's like, I've actually been thinking about, he's had some unprotected sex and stuff, and he's like, oh, nothing's ever happened. So he's like, oh, let me see, and most guys would not do it. Most guys would not do it. So I'm just glad that he volunteered for it, and it was great. I mean,
yeah, it was
when
awesome.
would you think a young man who's single in that situation should have their semen an analysis? What age? We always talk about the medical gap for boys, and
whenever they want. I mean, if they're worried about their fertility, the problem right now is that we wait until there is a problem. So why not try to figure it out before it's a problem? So if you are in a high stress job environment, because stress can affect fertility counts. If you are overweight or obese, actually a study that just came out, 50% of America is overweight now. 50%, 1 out of 2 of us. So overweight, yes, it can lead to heart disease, diabetes, all these other things, but it can also cause a decline in sperm counts and cause a decline in functional good sperm. So if you're concerned, then might as well check now, because what's cool about Trak is, and I'm not paid to say any of this stuff, but what's cool it is that it gives you things that you can do to improve your sperm counts when you're tracking it. So, most guys, one of their excuses is, oh, there's too much information, I don't know what to do. Well, it tells you what to do with all your lifestyle stuff. If you smoke, this is what they recommend. If you're overweight, this is what they recommend. If you're eating too much of one thing, hey, maybe you should eat the following things which help your fertility. So I think it's pretty cool. So, if you're interested, just check it. Why not?
And so can you talk about, I know before we always talk about this, but then it's also so awesome to have that because you need to recheck too, right? Because that semen or sperm snapshot that you're getting isn't from today. It's from how many weeks ago, right?
So any changes we make today, it takes about 3 months, because that's the life cycle of your sperm. So, if you start exercising today or dieting today, it's going to take at least 2 to 3 months before we notice a difference in your actual semen analyses. So you're right. And the other thing you mentioned is, you need it confirmed. Yes. So, things like Trak, and there's some other competitors out there. That's just a start. It doesn't replace me or your fertility specialist. You still need it checked. You still need a deeper evaluation. But what this does, it gives you access. So kind of like when you go to your local grocery store and there's a blood pressure machine there where you can just kind of, when no one's looking, check your blood pressure. This is the same thing that you can do in the comfort of your own home. So if you were interested and worried, then you can do it at home instead of having to call a doctor's office, wait outside a doctor's office lobby, then wait for them to see you, and then masturbate in their semen analysis room. So, you know, this is, you're watching the NBA Finals, watching Kevin Durant win his first ring, and you can get your semen analysis at the same time. Hey, voila.
You know what I love about you and your approach about that is because, you know, there has been other physicians that say that it further pushes a man away from going into the doctor. And I don't agree with that. It's just like what you said, because it is at your time, in your convenience, to get the feedback that you need almost instantaneously, right? So yay, that's our commercial for that. But it's not about the product. It's really about the awareness of your body, right?
Yeah.
And what you can do to get that awareness that you need.
Exactly. I think also awareness and comfort level, like, you know, it takes you a time to be comfortable with your own what's going on, right? And sometimes you get feedback, multiple data points, and you're like, okay, this is really where I'm at, and this is really what I need to do. I'm going to start trying to take some steps, and at some point you realize you need more help to do that, right? And you feel confident because you've researched things, you understand where you're at. Now you feel prepared to have a discussion, and when you go in to see a doctor, you're more ready to discuss it, because you've been living it a little bit, rather than being like a deer in the headlights, like, oh crap, I just found out this news, and now what does that mean? And now, you know, you're just overwhelmed and you shut down.
Yeah, most people do when they overeat or, you know, go to the gym and you know, see everyone else around them, they get scared. So it's just, guys just suck at all this stuff. So we got to get them talking. And if it takes checking your sperm at home, then great, let's do it that way.
Yeah, I was talking to a gentleman, and I said that quote that men only go if they're bleeding, you know, or shot to the doctors, and about how, you know, this is such an important topic because it is so personal, just as it is personal for women, you know, on the other end for breast exams, and you know, creating a system that you're having feedback from yourself is so important. So that's why I love that you just nonchalantly talk about all this good stuff.
We did several stops on the drive, and what I realized is guys are not as like as dumb as we look, to be very honest with you. I mean, for lack of a better word, we went on the streets of Vegas and just did interviews like Jay Leno style, and most of the guys knew what they had to do. Most of the guys understood screening and the benefits. Most of the guys like knew what age to start doing certain of the more common screenings like colonoscopies, prostate PSAs. But most of the guys admitted that they're just either lazy or tired or too busy. So, you know, the education is there. You know, I always thought the education wasn't there. But what I realized after this trip is the education is there. They know, they just choose to ignore it.
Right. The gentleman I was talking to said he cancels his physical. So what do you think that is? I mean, what if you're in a relationship with a man, or, you know, I'm a mom to an 18-year-old son, how can you present it in a way that it would make themselves a priority? Because it feels like they're not putting their health a priority, right?
You know,
yeah, go ahead. Sorry.
I was just saying, in some guys that I've talked to, one really surprising thing, because I've like pushed on this, like, what? Okay, you're not a lazy guy, right? Like, you get up and you go to work at like 5 a.m, and then you do this, and then you do that, and you put people ahead of you. What is it that is like you're gonna put this off? And after long silence and really thinking, the answer comes back to me as news that could come back to me. It's either I'm fine, which is what I feel now, I'm fine, or I'm going to get bad news that I have to deal with, right? And so it's like that emotional step of, what do I do if it's not okay? A big barrier, because men don't have as much emotional support to deal with.
Right.
What do I do when it's not okay?
Right. Or
and they don't have
maybe they don't have permission to deal in an emotional way with it. But oh my goodness.
Right. Women want to be proactive, and we want to like whatever, and then it's like we want to know so we can fix it because whatever, right? But I think I think a lot of times guys just want to put it on the shelf because they don't want to make themselves the spotlight and have their own issue in front of them until it's like, well, this pain is really bothering me and I can't work now. So I need to go talk to a doctor because now I can't function. So obviously now I know something's wrong myself, you know, so I think there's a little bit of that anyway.
Sarah, I wanted to tell you guys a story. Remember, I think it was a couple of years ago when we were talking about, you know, the gap in medical care for men and how when your son turns 18 and they age out of the pediatrician, you know. So today was the day for physicals in my house, and my son was in the other room, and Cole's 18, so he's going to be aging out of the pediatrician. And before I left, I was talking about my son today. You're so helpful with him. And they had physicals today. And when I was leaving, the woman, you know, the doctor said, you know, so Cole, there's a couple things I want to talk to you about. You know, do you do, you know, monthly screening, you know, for cancer? And I'm going to blush, but he goes, oh, do you know my mom? Do you know what she does? He goes, yeah, I've been doing it for a while because she does these things called the Making Dad Summit, and she had this doctor talk about it, and he told me I had to, so I've been doing it since. And you know what? It was just serendipity because I never asked him, you know, after you talked about it, doctor, I said, you know what, I want you to listen to this. And he's like, yeah, I've been doing them since you did it. I think it was 2 years ago. Mm-hmm. And if I wasn't like the fly in the wall in the pediatrician's office today of all days, I wouldn't know that. So how cool is that? So those are the subtle, amazing changes you make with your Drive for Men. Mm-hmm. You know, talking on the street, getting people together, what you do on your bus. You know,
the most memorable one was these club promoters in Vegas. And, you know, they're like promoting clubs and talking about how, you know, all the good looking people get into the clubs. And but we're like, you know, what's the problem that you face? He's like, we drink too much. Like, he just said it. He's like, we as promoters, we're on the streets, and we tend to just drink a lot. I mean, I guess before or afterwards or what. And he's like, it's a big problem. And then we kind of, you know, talk to them about, you know, caloric intake and, you know, how alcoholism is so prevalent in the male population. And a lot of it is because of, you know, underlying psychological issues they may have that they don't talk about: anxiety, depression, stress. And he's like, oh yeah, you know, it seemed like he was enlightened and wanting to start the conversation with his colleagues, but, you know, all we can do is kind of inspire, and then the rest is in their hands. But I was shocked by what he said about that. And, you know, I forgot to bring this up then, but too much alcohol can also affect your fertility and your sperm counts too. So
did you ask him why they drink?
He just said, you know, we didn't really get into that conversation, but I'm assuming, you know, they're probably bored, or, you know, they're on the streets all day in the hot Vegas weather trying to recruit people to go to the clubs. I'm not sure. I should have, if we had more time, I would have dwelled more.
No, I was just wondering if it's because they drink with the people they're asking. But you know what? It's that awareness of it too, right? So connecting those dots. And I bet you he's not even thinking fertility, right?
Most of them don't want to be fertile. They want to have fun and not worry about the consequences. But you know, you got to start making them think about it now.
That's awesome.
But one thing I want to bring up, this is such a bad segue, but porn. So okay. A lot of patients I see, you know, think that, you know, they're all supposed to be like, you know, 2 feet long penises, and they're supposed to have sex for an hour, and, you know, their wife is going to do every single position that they ask. And the reality is it's no, no, and no. You know, the average penile length is like between 5 and 6 inches. The average sexual encounter is between 5 and 6 minutes. And most women are not comfortable doing a lot of the things that you may see on there. So that is not a reality. And, you know, I spend a lot of time like telling young guys this stuff. I'm like, dude, they either come in because they think they have premature ejaculation when they don't. When, you know, they either come in and because they're like concerned about the size of their penis, or it's not circumcised and they want to circumcise because they want to look like porn stars. And, you know, a lot of the discussion is you don't need to do these things because you're just fine. So.
Yeah, I mean, that is a really great point. I get a lot of those kind of questions, younger guys, or they're just starting their relationships, like, you know, they haven't had actual sex, but they've like masturbated a lot in their life, and then they don't know how to do actual real sex, or they wonder if they're hurting themselves, or they need, I mean, there's so much, I think, unanswered stuff that made this really kind of come to my mind as like a thing to talk about, because there's just a lot there.
Well, I think what you just said in such a man kind of way. Okay, guys, you're fine. It's between 5 and 6 and 5 and 6 minutes. You know, it's not 25 hours, you know.
There's guys out there that are going to refute that claim. But you look at...
well, that's your job all day long, right? That's where you live. So you're the expert, not the masturbation, but you know what I mean? You're the urologist. That's what you see every day. So you know. I know that is a concern for some of the younger people that are starting to have experienced infertility. And that's where I, you know, kind of self-judgment. And it's funny because Sara and I were talking about that, like the self-criticalness of themselves, about, you know, the disconnect between how beautiful their body is to what they've done to I've done something wrong, and self-judgment, and, you know, taking that bus into a place that is not healthy.
You know, and you bring up a great point. You gotta be comfortable with your own skin, and you know, women deal with this constantly because you open up social media, you open up a magazine, there's that perfect woman, and men deal the same way. You open up the magazine, social media, and you have the perfect man, but a lot of those perfections are photoshopped. So the reality is not all these guys have six packs and they don't have, you know, big bulges in their pants and, you know, size D breast. It's all photoshopped. And if you Google like celebrity Photoshop, you will see that these people don't look like that.
Right.
And a lot of that leads to insecurities. And I think that's why, you know, when people are experimenting or having sex or in relationships, they're very uncomfortable. Like I have a friend that won't take his shirt off. He won't take his shirt off. He's so uncomfortable with his upper body that he just won't take it off. And I'm like, dude, you're fine. Like, what are you like? What's wrong?
That's sad to me, isn't it? That we're in a culture that there's such self-criticism of who you are and how amazing, you know?
Yeah. You just got to be comfortable with what you have. You can't really change it. And, you know, I know there's those shows of guys spending millions of dollars and perfecting their bodies. But that stuff is dangerous. Like, you know, certain plastic surgery is fine, a little Botox or, you know, some other things. But the big major stuff where you're kind of changing who you are to look like a Ken doll is that's dangerous, you know, and that's millions of dollars wasted. I would never recommend that to anyone.
Well, can I ask you a personal question about how you know, you've made a commitment and you are living the commitment of a healthy lifestyle, of healthy being and exercising. And so maybe if you could talk about how when you first started, you know, the pain when you were going through it to now, like you've gotten to a place of balance there, right? And
yeah, but it's a daily struggle. It's a daily struggle. So I was, and it's been like a yo-yo. Like I was up and then I was down and then I got back up and then I got back down before the drive this year. And then now, like, you know, I'm still at a healthy weight, but, you know, I'm not where I was a year ago. And it's a constant mental battle because I look at, you know, what my wife has cooked when I get home versus what I should eat, you know, because we got to feed our kids. So she makes delicious, like, carb heavy food. And then I'm like, damn, like I want to eat that. And then, you know, right now I've been here at the hospital since 7. I'm not going to get home till like 9. And so when do you go to the gym? So it's a constant battle. But, you know, we had one guy talk on our live webcast, which really enlightened me. Was his name is Sham Chaudhry. He's the founder of Indie Fresh. It's like a big juicing company out of New York. And if you watch him on Instagram, it's constantly like working out and, you know, doing 1 or 2 fitness classes a day and then has personal training and running. And I'm like, dude, like, how am I supposed to like emulate? He's like, don't. He's like, I just do it because I enjoy doing it. But most men need to realize just if you have a goal, start off at a 50% intensity. If you go in at 100%, you're going to get burnt out. And that's what happened to me. I got burnt out after the last drive. Like, I just gave up for a couple months. But he's like, if you keep it at 50%, whatever your goals are in life, 50% intensity, you're going to be able to get 100% of your goals. And so, it's all great if you look on social media, it looks like I'm perfect and stuff, but I'm not. And that's another reality. Social media is not reality. It's you pick and choose and you filter what you want to put up there.
That's totally true. My husband calls it our family propaganda.
Yeah. Yeah, like,
the nice moments.
Sarah has the perfect kids and I have the perfect kids and all look pretty all the time. But the reality,
they never fight.
But that is so important what you just said, because it's a cycle, it's a balance, and I think for me, when I'm coaching people, I talk about, well, what have you learned? Look at it as a learning about you and a curiosity about you, instead of judging yourself that, oh, I was up and I was down, or I did this and I did that. Well, ask yourself, well, what were you feeling? And, what did you learn about yourself? And go from there, instead of making it such a critical point of view. I understand that, because I've been always mindful of my weight and exercising and doing this thing. And then, 50 years old, your body changes. And so then it's what you're talking about, what you see outside comes in, and then you criticize yourself. Right. And I think it's so helpful for you to share your personal experience.
No one's perfect. You're not perfect. Just enjoy life and have a good balance, and 50% intensity. Don't get burnt out. And don't watch too much porn, and just have some fun, and make sure you have a healthcare professional that you can call your friend. I mean, that's basic. Our message is so simple for the Drive for Men's Health, because we've complicated healthcare so much with all these different age-based guidelines and all these things. Like, if you even me, like when I go to the doctor's office, I'm like, man, should I get B12 checked? Should I get calcium checked? Should I get this checked? Even if I get this confused, what about the average person that doesn't have a healthcare background? How confused they can get.
Right.
Just tell people to get active, eat better, and let your doctor make your roadmap for you. Don't try to make it based on what you think is right. Your doctor, if you give them enough history and your family history, they're going to do it for you. So don't complicate your healthcare. Keep it simple.
Yeah, I was just writing an article about prostate health is my latest one that I'm working on. And like prostate and low T, they're like two things that impact men a lot, and especially as they age. And when the symptoms of these things are things you don't talk about, like, they're just like, oh, I have trouble peeing, and then I can't focus. And I mean, they're just like stuff that I think the doctor to be your friend is really important, because being able to have a conversation, like, honestly, I mean, it comes back to this masturbation thing, right? Like, honestly, I'm actually ejaculating 3 times a day, or I haven't had sex in 3 weeks, whatever it is. Like, because that's another thing, is people just assume everybody has sex all the time. And that's not true either. Like, sometimes you'll go for a long dry spell and you won't like it. And you go a month or 2 or whatever. And it,
No, I'm just kidding. No, I agree with you. But listen,
right?
I think this is awesome.
Yeah, I gotta go do my next case here. But well, if there's any other questions, go ahead and ask us on social media, and I'll try to answer them on Twitter or Facebook. But it truly has been a pleasure, kind of just being honest. Like, I think I've evolved since our first one. I remember our first conversation. I was very like just super correct and professional and by the book. And I think I've relaxed too in these conversations. You just have to be real, man.
You are, man. And we love you, man. Go save lives.
All right. Thank you for having me on this call today. Thank you.
Yeah.
Love you. Bye, honey.
For joining us.